Thank you, Lisa. Like I said, we'll wait about 2 more minutes, see if additional folks join. I appreciate your patience, and then we'll go ahead and get started. Okay. Well, good afternoon, everyone, and welcome to Intermountain Healthcare's Nevada Medicare 101 presentation. My name is Neil Finn. I'm the manager and broker of community relations here at Intermountain Healthcare, formerly Healthcare Partners. Our team typically hosts and attends in-person events to connect with our Southern Nevada community and share the exciting things we're doing at the organization to care for our patients. Although we're not currently able to connect with you in person, we're thrilled to have launched virtual events to connect with you from the comfort of your own home. Now, we understand that enrolling Medicare is a very important decision, and we appreciate you joining us today to learn more about your Medicare options. We're joined today by Angel Fernandez. He's a licensed insurance agent with the Smart Buy agency. But before I turn it over to Angel, I'd like to share a little bit more about Intermountain Healthcare. Next slide, please. Intermountain Healthcare is a well-respected regional health system and a team of caregivers who serve the needs of people across the Intermountain West, with facilities from Utah to Idaho and now Southern Nevada. Additionally, we provide telehealth services and partnership agreements across a much broader area of the Western United States. Intermountain Healthcare has been recognized by national leaders as being among the top 5 health systems in the country and is considered a model health system for providing high quality care at affordable cost. Both Healthcare Partners Nevada and Intermountain Healthcare align in our missions and values of helping people live the healthiest lives possible in Southern Nevada. If you're an existing patient and receive the same high quality health care from providers and care teams, you've come to know at the same locations. The strengths of Healthcare Partners in Nevada are combined with the expertise of Intermountain Healthcare to create a stronger, more comprehensive regional healthcare system. Next slide, please. Now, we're incredibly proud of our provider network and the high quality healthcare services that we offer our Southern Nevada community. We have nearly 300 primary care providers at more than 100 primary care locations. We're excited to share a little bit more about My Generation Senior Clinics on the next slide. Currently, we have 30 senior-focused clinics in Southern Nevada. Our provider network also includes access to over 1,500 specialists, 25 urgent cares and walk-in locations, 20 hospitals, plus virtual visits with your care team. Next slide, please. Now, our My Generation Senior Clinics feature concierge-style primary care designed specifically for our Medicare Advantage patients. The unique clinic concept has a lot of extra care team support, plus amazing access standards to help our patients get care when and where they need it. You'll have access to a dedicated referral team, on-site care management, and navigator support, plus some locations have an on-site lab. New patients will be seen within 2 weeks, while established patients will be seen within 2 days when medically necessary. We also offer same-day appointments for urgent needs. Now, we limit the panel size of each provider to 750 patients, so each patient can spend more time with their provider. In fact, our average appointment time is 30 minutes, which is twice as long as the industry standard. As mentioned earlier, we do offer virtual visits to help our patients stay safe and healthy at home while accessing care. Next slide, please. Now, here's a map of our My Generation Senior Clinics. We have 30 locations, 100 senior-focused providers at these 30 locations. 5 of the clinics which you see in green are Humana-affiliated practices only, so only Humana and Medicare Advantage members can access care at those locations. but the remaining 25 in blue accept both Humana and United Healthcare Medicare Advantage plans. If you'd like to become a My Generation patient, simply call a clinic near you and we'll get your first appointment scheduled today. Now, during the presentation, you do have the ability to type in the chat feature. So if you have some questions, please go ahead and type that in the chat feature, and we'll address those at the Q&A at the end. At the beginning, you saw a little pop-up question, and we'll also have some of those interactive pop-up questions during the presentation as well. So we'd love to get your feedback. So with that, I will go ahead and hand it over to Angel. Angel?
All right. Hello, everybody. Thank you so much, Neil. All righty. Perfect. So my name is Angel Fernandez, and I'm going to be going over 7 Medicare mistakes to avoid, as well as going over some information that can be useful for you when it comes to either enrolling for Medicare or just getting some general questions answered as well. Lisa, if you don't mind going to the next slide, please. All right. So today I'm going to, of course, go over an introduction on what I do, why I do my job, and why I'm a health insurance broker, the advantage of working with a local licensed senior advisor, the A, B, C, and D of Medicare, what your Medicare options are, how to avoid late enrollment penalties, understanding Medicaid, how to save on prescriptions, and how to avoid those 7 costly mistakes of Medicare. Employer coverage and Medicare are also good, important tips, so we'll also touch in on that. If you don't mind, Lisa, go to the next slide, please. Okay, so my why is I've been involved with Medicare for going on to 5 years now. I was born and raised here in Las Vegas, Nevada. I went to high school here, and right after high school, I actually had an acquaintance that I met that did health insurance. I didn't know anything about the industry, and I just wanted to get into the community and help out. And after I started getting licensed, I noticed a lot of seniors didn't have the proper information with the plans, or more than anything, it was hard to get the right information. So I started learning more about Medicare, and after year, I learned where I'm at today, and I've been grateful to be able to help out hundreds of seniors here in Las Vegas, and I've also been working in Reno these past couple of weeks as well. Feel free to take my number down if you do have questions in the future regarding Medicare. My number is right there, and it's at the end of each slide as well. Any questions so far? All right, fantastic. We'll go on to the next slide, Lisa. Okay, so the advantage of working with a local licensed senior advisor, you get additional services at no cost to you. And by what I mean by that is, one, I, of course, can go to your home, help you out with Medicare questions, either getting information on the plans, or simply saving you the hassle of calling the 1-800 numbers. Sometimes giving them a call can, well, one, of course, the long hold times, and secondly, depending on the carrier, of course, language barrier might be an issue. Whatever the case may be, it's good to have a direct contact, and that's where I would come in. Working with me locally, I can, of course, help you in the following ways, giving you guidance on what plan is best suited for you. I typically do a needs analysis just to verify what your medications are, what current doctors you're seeing, and we make sure that everything is still covered to avoid any hassle on your end. I do know local provider groups, pharmacies, dentists, and durable medical equipment companies here in Las Vegas. And I can also be your health navigator in the turbulent journey of healthcare. There's always something new going on, so it's good to be informed. Moving forward, that should be it on this slide, if you don't mind, Lisa. Okay, so this is where you get the breakdown of what Medicare is. So when you first turn 65, or if you're disabled for 2 years, you're automatically entitled for hospital coverage, which is also known as Part A. Part A typically has no cost affiliated with the program. However, if you haven't worked here for over 10 years, it does have a monthly premium. In most cases, 90% of people don't pay for that because we've all worked here for 10 years. We've paid taxes. Now, medical is the one that most people pay for, and that is $148.50. I know that the question that popped up earlier was actually about this. So 148 is the national premium. However, if you're making higher income, it can actually go up. So once people's income reaches anywhere from 88,000 a year all the way up to 200,000 a year, the premium can get all the way up to $500 a month in some cases. I personally do suggest always verifying with a broker if there's a possibility of saving that money, because there is Medicaid. There's a lot of assistance programs that can perhaps lower that monthly premium as much as possible. And that's where we can come in and guide you on that. Now, when you have Part A, and I'm sorry, was there a question so far? Okay. Now, when you have Part A and Part B, it is mandatory by law to have credible drug coverage, and that's where the Part D comes into play. So prescription drugs, even if you don't take any medications, it is mandatory by law to have it. It does have consequences, and I'll touch in on that shortly. Now, the alternative option is also a Medicare Advantage. The Medicare Advantage, the way it works is it includes your hospital, your medical, and your prescriptions all under one umbrella, and it's managed through a private insurance company. Now, typically those plans do cover dental and vision in some cases as well. So that is the route that a lot of clients of mine tend to take. And typically I like to explain all the options and see which one is best for you, because sometimes Medicare Advantage isn't the right option. Sometimes original Medicare is, but it's always good to know what's available and what's good and what's bad of them, of course. Feel free, Lisa, if you don't mind going to the next slide. Okay. Now, do I have any questions so far about what Medicare covers, Part A, Part B? Okay. So the options that you have when you get Medicare, of course, you can stay on Part A and Part B, which is also known as Original Medicare, and get a prescription drug plan. However, Medicare Original only covers 80% of your medical and your hospital services. So what that means is if you go to the doctor, and let's just say the doctor charges $100 for the doctor's appointment, your co-insurance for that would be $20. Now, depending on the type of services that may be done, that can get costly, especially if we're talking towards MRIs or any type of diagnostic procedure, because those tend to get a little more expensive. You can also purchase a supplement, and that helps to pick up that 20% gap to make sure that you're covered 100% and you don't have to pay out of your own pocket for any services. Now, those can range anywhere from $90 to $180 per month, depending on the plan and your condition, as well as you can also obtain the Part C, which is a Medicare Advantage plan. And typically with those plans, they have set co-payments instead of percentages. So when you go to the doctor, you actually know what you're going to spend. You don't have that worry of knowing, well, I wonder how much it's going to cost me to do this, or how much is it going to cost me to do this other procedure. You know what it's going to cost you. And you can also call your broker and find out what your copay would be for such procedure as well. Do I have any questions about this topic here? Okay, fantastic. Go ahead, Lisa, if you don't mind. Okay, so I do have a question that I want to ask you guys, if you don't mind, Lisa, launching the poll on the late enrollment penalty. The question is, do you know what the late enrollment penalty is? Okay, got one response here. Why is there a penalty? Good question. So there's a late enrollment penalty because when you get on Medicare, if you don't obtain that prescription drug plan, you do get penalized. And a lot of people don't know this, but that penalty never goes away. It automatically gets added to your Part B premium. So if you're getting deducted the $148, Medicare will charge you a 1% of what the national premium is. And it typically does go up every year, So that penalty does not go away. It doesn't, it's not too much, of course, but that amount that they're charging you does eventually add up, of course. So if you don't have that credible coverage for 63 days, that's when they'll automatically start to charge you that penalty. Now, you can also get that penalty if you don't sign up for Part B within a certain amount of time as well. So a lot of people sometimes get Part A and they say, oh, well, I don't need medical, so I'll waive the Part B. That can also result in a penalty, and a lot of people don't know that. To avoid these penalties, of course, you want to contact a local licensed professional to discuss your options. And also, if you do not have any coverage, whether it's through work or through the state, whatever the case may be, make sure that you always have your Part B active, because if you don't, then that's when that penalty comes into play. Any questions about the Part D prescriptions or enrollment penalties? Okay. Next slide for me, Lisa. Okay. So I have one more poll that I'd like to add, and it's going to be do you know the difference between Medicare and Medicaid? Okay. Fantastic. Okay, so next question. Do you know the difference between Medicare and Medicaid? Okay, so what Medicare is the federal program that you get automatically when you turn 65 or if you're disabled for 2 years. Now, Medicare is going to cover 80% of all medical costs, and you're entitled to, of course, obtain a Part C if you'd like. Now, when you have Medicaid, Medicaid is a state program meant for anybody of any age, and it covers what Medicare doesn't cover essentially in most cases. Now, there's actually 4 different levels to Medicaid, all starting from level 1, which is where they pay for your monthly premium of the $148. And it goes up, of course, all the way up until where you pay 0 copays, 0 premiums, and 0 deductibles. So typically, to qualify for Medicaid, a lot of people don't know, but they may actually qualify. Depending on your income, depending on how much people you have in your household, they determine that to give you that eligibility. And if you do qualify for it, there's actually new plans that just came into Clark County this year that are called dual special needs plans. And those plans can help you save money. They give you incentives for food credits, transportation to the doctor. There's always something new going on with these programs. So it's very good to be informed. Like I said, it's the first year in Clark County that we get those plans. So it's always good to be informed on those. If you do need assistance for Medicaid, feel free to reach out to me. I'd be more than happy to help you out and walk you through the entire process as well. Okay. Any questions so far? Okay, fantastic. Next slide, please. Okay. And a topic that comes up a lot actually when I'm in someone's home or just meeting with the client is prescriptions, because those add up. I mean, the cost for prescriptions, depending on the medication, can range anywhere from $0 all the way up to $50 a month. So there is a state, well, it's actually federal now. It's a federal program called Social Security Extra Help, and it can help you lower your prescription drug costs. That program is offered by the federal government, and it can help you lower your prescriptions down to $3 to $9, depending on the medication. The maximum that you would ever pay is $9. This applies for any brand medication as well. So I have met a couple of people that sometimes they take, for example, insulin, and the copayment for insulin can range from $47 to $130 a month, depending on the plan. So to know you can save that, drop it down to $9, it's a huge advantage. And these applications are free to submit, and it doesn't affect anything. I can help you apply, and you get the response in the mail. 90% of people that I've helped apply do qualify for it, as long as they meet the requirements, of course. Any questions on extra help? Okay, next slide, please. Okay. And lastly, I do want to touch in on employer coverage, because that is huge. I've met people that have both, and I know that it's a big area of confusion in some cases, because some people don't know if they can use one or the other, or if they should combine them. And one good thing is that if you are on employer coverage and have Medicare at the same time, you can keep your employer coverage and use your Medicare, combine them together, and it does help pick up the cost that Medicare doesn't cover. So that helps save people a lot of money in medications or just copays for the doctor. You do have to keep paying for the $148 a month, of course. Now, if you decide to stick only with your employer coverage, that's also an option. You do not get penalized due to the fact that you still had credible coverage at the time, so you can only have your Part A Medicare and have your employer coverage active. However, the month that that employer coverage ends, it does need to be priority to enroll for Part B, so that way you don't have that penalty coming in down the line. Typically, you do have 2 months after you retire to obtain your Medicare card. And then sometimes, depending on the work coverage, of course, it can get more expensive to keep it through your work. So it's always good to review your options and figure out which one is best for you. Besides that, that does finalize my presentation. If I'm not mistaken, I think this is the last slide. Okay, yes. So I'm going to just touch in on everything that we talked about. So number one, of course, do not have any of these mistakes happen to you. I've seen a lot of different scenarios, and it's always good to be informed. Share it with a friend if you have to as well. Missing enrollment deadlines is a big one. Annual enrollment period is from October 15th to December 7th. If you do have questions about a plan, that is the time to do so. Ask the questions, reach out to your local broker, and we'd be more than happy to help you out. Same thing for Medigap. Don't want to miss that open enrollment period. Enrolling in Medicare Part B too early, you don't want to do that. So typically you want to enroll for Part B 60 days before or 60 days after you've lost coverage through an employer. If you do it after that, it closes your window, and you typically do have to wait up to a year to get that health insurance active. So it's always good to know that part. Failing to apply for low-income subsidy. You know, what doesn't tell you you don't qualify now, and perhaps you can save some money on your medications. Mistaking Medicare Advantage for Medigap, or mistaking it for a supplement, because sometimes people think Medicare Advantage is a supplement, but it's actually not. It just takes place of the Medicare original. Failure to ensure what is not covered by Medicare. So that's a huge one, because a lot of people are unaware that Medicare covers preventive screenings, blood work, labs, whatever the case may be. It does cover all medical and all hospital needs. Now, when you look at the Advantage route, that's where you add the dental and the vision in most cases. A big one is, I'm sure you guys that meds are changing every single year. And typically we notice these benefits are getting better, and it's a good thing, but it's important to review your plan once a year. What doesn't tell you you can obtain more benefits at no extra cost without compromising your doctors, your medications. So it's always good to be informed on what's new in the community. Next slide, please. Fantastic. So that should be it for me there today. Is there any questions from any of the participants? Okay, we're good. Yeah, well, if anything comes up, my contact information is there. Feel free to use me as a resource. I'd be more than happy to answer any questions you may have. All right, Neil, I think you're muted.
Is that better?
That we hear you loud and clear now.
Very good. Thank you. Sorry about that. As Angel said, if you like myself, always think of the question, after the presentation, feel free to certainly reach out to him directly by the phone call or email. I'd be happy to answer any questions. As you mentioned before, there's no obligation. He's there to help. So wonderful to see everyone here today. Appreciate the time, and we hope to see you in future events like this as well. So everyone stay safe and be healthy. Thanks. Bye-bye now.
All right, bye. Thank you, everyone.
Bye-bye.